Hey guys, as promised, this is ABG interpretation for partially, fully, and uncompensated ABGs. We went through this in class. This is just a review. I'd like to start with some tools. So as you know, I use Rome method, respiratory opposite, metabolic equal. And this refers to the arrows or what's high or low. Additionally, I put on the number line, again, back to like first grade, but sometimes the number line really helps. So looking at the blood pH, 7.35 to 7.45 are our normal values. So within that range is normal or neutral. However, when we get to partially compensated, when we get to fully compensated, the pH might have a normal range. However, it might be because it's fully compensated versus just being a normal ABG. That's when we look at our other values. So we have our respiratory value, which is our CO2. You might see PaCO2. So for your CO2, that is the acid. So the more acid we have, the more acid is in the body. 35 to 45 is a normal value. So greater than 45, we're thinking more acid. For metabolic or the kidneys, that's our HCO3, our bicarbonate, HCO3. So 22 to 26 is the normal range, and our HCO3 is our base or alkalotic. So our HCO3 is our base. The more base we have in the body, the more alkalotic we are. So let's look at some ABGs. You'll see on each slide I have my little tools. I highly suggest that you write something like this on your test when you're taking it, so you have your tools by you the whole time. Again, respiratory opposite, we're looking at those arrows. Is it high or low? Metabolic equal, we're looking at the arrows. Are they facing the same way or not? So let's start. So looking at our pH, bear with me as I try to use these things. Looking at our pH, is this high or low? 7.25. That's low. So I'm going to do an arrow to the best of my ability, facing down. Our CO2 of 58, is this high, low, or normal? It's high. 58 is above 45, so this is high. Our HCO3 of 24. So remember, HCO3 is our 22 to 26. So this is in range, right? So I'm going to do an N for normal. So if I go back and look at my Rome, and I think respiratory opposite, metabolic equal, I'm going to see that my arrows here are facing the opposite direction. And my CO2 is my respiratory. That's an R. And my HCO3 is metabolic. So looking at that, respiratory opposite, I have opposite facing arrows for my respiratory to my pH. So I'm going to be thinking that this is respiratory acidosis. So this is respiratory acidosis. I can't write that. Respiratory acidosis. Uncompensated, because our pH is not in normal range and our HCO3 is normal. So reasons for this. This could be COPD, it could be an opiate overdose, could be pneumonia, paralysis, coma. For some reason, this patient is retaining CO2, so their CO2 is high, which is an acid, so they're respiratory acidosis. Moving on. So here we have a pH of 7.47, a CO2 of 47, and an HCO3 of 32. So looking at our pH of 7.47, that is high, correct? Yeah. So I'm going to do an arrow facing up to the best of my ability. Then I'm going to look at my CO2, 35 to 45. So 35 to 45. So 47 is high, right? Right. So I'm going to do an arrow facing up. Then I'm going to look at my HCO3, my bicarbonate, my base. That is high. So now I'm going to go back over and look at my respiratory opposite, metabolic equal. And keep in mind that when my arrows are facing opposite way, it's respiratory. And when they're facing equal, it's metabolic. So I'm going to remember that my CO2 is respiratory, my HCO3 is my metabolic. So thinking about it that way, I am going to believe that this is metabolic alkalosis, but it is partially compensated. My lungs are trying to reserve some acid. So I'm partially compensated because my pH is not within normal range. So this is metabolic alkalosis, partially compensated. This can be due to vomiting, continuous GI suctioning or NG suctioning. So those are two reasons that this could be. All right, let's keep it going. So for this ABG, we have a pH of 7.37, and that is normal. Our CO2 is 66. Looking at our CO2 range of 35 to 45, this is elevated. I'm going to do an arrow up. And then our HCO3, which is normally 22 to 26, is 32, so that is also elevated. So when we look at this, we have an elevated CO2 and an elevated HCO3. However, our pH is normal. So when we look at this 7.37, we can come down here and we look at our number line. And we can plot that right here on the number line. So looking at that, we see it's in the acidotic range. So I'm going to say that it's on the low end of normal. So I'm going to do an arrow down. Now if I look over at Rome, again, respiratory opposite, metabolic equal, I'm going to see that my respiratory arrow faces up and my pH faces down. My metabolic arrow faces up. So if I'm looking at my opposites right here, respiratory opposite, I see that this is going to be respiratory acidosis. So it's respiratory acidosis. I can't really write that. But we are compensated. And now since we are normal level, we are fully compensated. So respiratory acidosis with full compensation. So that means that our problems are respiratory. Maybe we have COPD, maybe it's an opiate overdose, but now our kidneys are working their kidneys off to try to neutralize, which they've done a great job since our pH is in normal range. And now we are respiratory acidosis, but we are fully compensated. Okay. ABG interpretation for this one. So looking at this, we have a pH of 7.30. So that is low because it's less than the 7.35. So we're going to do an arrow down. Our CO2 is 54. Our normal range is 35 to 45. So our CO2 is high. Our HCO3 is 31. Our normal range is 22 to 26. So our HCO3 is high. So remembering Rome, respiratory opposite, metabolic equal, when we look at our arrows, our pH is facing down. So if we look at our respiratory one, our CO2, it's facing up. So there's our opposites. And then if we look at our metabolic, it's facing up. So it's not equal. So this is going to be respiratory acidosis. However, since our kidneys are working really hard, we're going to be partially compensated. And what makes us partially compensated is that we can tell our kidneys are working hard because our HCO3 is elevated, but our pH is still not within range, which makes it partially rather than fully compensated. So we're partially compensated respiratory acidosis. All right, so looking at this ABG, we have a pH of 7.36. So this is normal. Our our CO2, so our CO2, our respiratory value is 30. So that is low. Our HCO3 is 14, which is also low. So now I'm going to come over to my number line, and I'm going to plot my 7.36, because I see that these lab values, these are both low. So now I need to figure out which disorder it is. So I'm going to come over here, and I'm going to plot my number. So 7.36 is on that low end. So I'm going to go right here. It's on that low end of normal. So it's acidotic. So I'm going to do an arrow down because, again, it's on that low end. So it's lower. And then I'm going to go and think about my Rome, respiratory opposite, metabolic equal, and see, is my respiratory opposite of my pH? No, they both face down. Is my metabolic equal? Correct, they both face down. So this is going to be metabolic acidosis, but we're fully compensated. So we're fully compensated metabolic acidosis. And we're fully compensated because that pH is within a normal range. Metabolic acidosis, this is common with DKA patients. Then they're going to start breathing faster and deeper. That's the respiratory system compensating to blow off CO2. Remember, CO2 is acid. Acid's out the mouth. So that's what's happening here. We could say the patient's in DKA and now they're short of breath because their respiratory system's trying to compensate, which it's done a pretty good job since they're fully compensated with a normal pH. All right, so this ABG, so we have a pH of 7.22, that is very low. We have a CO2 of 32, which is also low. And then we have an HCO3 of 15, which is very low. So all of them are facing down. Again, respiratory opposite, metabolic equal. So is our respiratory arrow opposite? No. Is our metabolic equal? Yes. So this is going to be partially compensated metabolic acidosis. And now it's partially compensated because our lungs are working. They are trying to work. That's why this arrow's down, it's low. However, it's only partially compensated because our pH is still out of range. So it's partially compensated metabolic acidosis. All right, so this one we have a pH of 7.49, which is high. We have a CO2 of 40, which is normal. And we have an HCO3 of 28, which is high. So remember our Rome, respiratory opposite, metabolic equal. So respiratory is normal, so we're not really even looking here. Respiratory is not even involved. Our metabolic's equal, both of our arrows are facing up. So this is going to be metabolic alkalosis. And now remember, your HCO3 is base. So if you have a high amount of base, you're alkalotic. And your pH is high, which makes you alkalotic. This is your metabolic alkalosis. This is uncompensated. So this is common with like vomiting and G-tube suctioning, anything that's making that acid come out. And remember, acid's out the mouth, base is out the butt. So acid out the mouth, vomiting, and G-tube suctioning is going to make your patient alkalotic because that acid is gone. So this ABG, we have a pH of 7.51. Is this high or low? That's right, it's high. We have a CO2 of 26. Is this high or low? low. HCO3 of 17, high or low? That's low. So again, respiratory opposite, metabolic equal. What are our arrows looking like? So we're going to be respiratory opposite, right? Because our arrows are facing opposite of each other. Metabolic equal wouldn't work because they're also facing opposite. So it's respiratory opposite. So we notice that our kidneys are working though, because our bicarb, our HCO3 is low. It's 17, it's low. So it's trying to reserve some acid. It's trying to get rid of base. We are low on base. The kidneys are working really hard. So we are partially compensated respiratory alkalosis. And again, we're partially because that pH is still out of range. So respiratory alkalosis can be hyperventilation. So your patient's breathing really fast, breathing off all that CO2. Maybe they're anxious, and that's why they're hyperventilating. Maybe they're hiking at a high elevation. When we're up in the Alps, think elk. So we are partially compensated respiratory alkalosis. All right, so this one, we have a pH of 7.44. That is normal. That is within our range of 7.35 to 7.45. So it's normal. We have a CO2 of 49. That is elevated because CO2 is 35 to 45. We have an HCO3 of 32. That is high because we have we have a 32 and normal range is 22 to 26. So now I'm going to come over to my number line and I want to plot it because I want to figure out where we're at. So if this blue line on the right here is 7.45, 7.44 is like right here. So looking at that, if I have 7.44, I am alkalotic, right? So I am going to be metabolic alkalosis. However, I am fully compensated because my pH is in that normal range. So fully compensated metabolic alkalosis. So for whatever reason, I was metabolic alkalosis. Maybe there was continuous NG sectioning. Maybe there was vomiting. But my body compensated. My respiratory system compensated. So I'm fully compensated with a normal pH now. And I have metabolic alkalosis. So this is fully compensated metabolic alkalosis. So it's a metabolic problem, but the respiratory system worked itself off to compensate for it. This might be the patient had a decreased respiratory rate to retain CO2, to retain acid. That could be one way that the body can compensate. All right. So looking at this ABG, we have a pH of 7.48. Is that high or low? It's high. We have a CO2 of 31. High or low? That's low. And we have an HCO3 of 24. High, low? That's normal. So respiratory opposite, which we are, respiratory opposite, metabolic equal. So metabolic, our kidneys are not part of this equation right now. So we're going to be respiratory alkalosis uncompensated. This could, again, be hyperventilation. Is your patient super anxious? Are they hiking at a high elevation with, poor oxygen? When you're up in the Alps, think elk. So it could be respiratory this is respiratory alkalosis, and it's uncompensated because our kidneys are not part of the equation. All right, so we have a pH of 7.33. So we are low. We have a CO2 of 39. That's normal. And we have an HCO3 of 20. that's low. Respiratory opposite, metabolic equal. Our arrows are facing the same way, so we're metabolic. Respiratory isn't even involved in this equation. So we are acidotic, we are low on base, so we are metabolic acidosis uncompensated. Metabolic acidosis, this could be disorders like DKA. All right, guys, thank you. This was your extra review on the ABG interpretation. I hope that you feel like you fully understand it. If you don't, please reach out to your professor for further clarification. Thank you.